Welcome to Building Innovation, the podcast, convening experts to discuss issues and solutions.
Hey, welcome everyone to another episode of Building Innovation, the podcast. Each month we convene subject matter experts to support advances in the building science and technology. I'm your host, Johnny Fortune, and I am so excited about this episode. We have two superstars in the industry today. Sasha Reed, the Senior Director of Industry Transformation for Procore, and Fred Mills, founder of the B1M, two mighty strong voices in the industry. Promoting innovation and advancements. Welcome to both of you. So glad that you're here with us today.
Thank you for having us. Excited.
Thanks for having us, Johnny. Good to be here.
Yeah. This is great. I've been wanting to do this for a while with you because this is a great topic we're going to talk about today. But I just wanted to just momentarily pause and just acknowledge, Sasha, you and I have had an opportunity to work together for many years as volunteers with the work at NIBS. And I've just always admired over the years you've continued to be on point with the topics impacting our industry, and really excited about our topic that we're going to talk about today. And Fred, I think we've been in some of the same circles, but this has been a great opportunity to connect with you and meet you in person for the first time.
Fantastic. Yeah, thanks, John. I'm excited to meet you too.
So today we are talking about a very important topic for the construction industry relating to mental wellness. And specifically, we'll be talking about an initiative called Get Construction Talking. So this is very exciting, and really just for our audience, want to dive right in. And what is Get Construction Talking?
So, to start us off, it's a global initiative that the B1M have put together with Procore to try and raise awareness and tackle the challenges of mental health in the construction sector. I'm somebody, I don't mind saying, who has struggled with their mental health themselves in recent years. I remember how shocked and confused and almost scared I felt by the situation. And in going through what I went through, I realized that this is something that can happen to anybody. It doesn't matter what your life might look like on paper or how strong you might appear externally. It doesn't discriminate. It can happen to anyone, and it's not a conscious choice. It's a sickness. And in going through what I went through, I, as you do, look at a number of resources and different things I could use to support me. And I discovered just how bad the mental health crisis was in the construction sector. I knew the issue had been there in the industry, but I didn't quite realize that it was the number one industry, sadly, for suicide across the US, UK, and Australia. Just in the UK, 2 people take their own lives every day in this industry. And it struck me that, I've been very lucky. I've been able to build a fantastic platform with the B1M. We reach 24 million people a month. But I wanted to use what I've built, that megaphone, that voice of what I've built, to try and move the dial on this critical industry issue and prevent other people feeling the way I had felt. We teamed up with Procore, so we've brought our sort of very large social media reach and online media presence, teamed it up with the enormous reach and influence of Procore, and we're trying to really move the dial on what is the most important critical issue in this sector.
Yeah, that's incredible. I did not know that was. I guess that stat that you shared was that it's the number one killer in construction industry. Is that correct? Did I hear that correctly?
It is, yeah. And I think you're 5 times more likely to die by suicide if you work in the construction sector in the US than you are in any other sector. And obviously there are a number of factors that feed into that and that relate to that. And it's a very complex, nuanced issue. But the fact that so many people working in this sector find themselves under the same pressures and it's not just struggling with their mental health, but at the most extremes, ending up taking their own life is incredibly tragic. And I think in a world where we are trying to bring more skilled people into the construction sector, and at a time where we're trying to sustain our workforce, grapple with the need to build more affordable housing, build in a more efficient, more productive way, and build in a more sustainable way so that our buildings and infrastructure and our built environment doesn't impact the climate as much, we need the best possible people. We need our people here switched on and engaged. So for me, this issue is absolutely fundamental. It's fundamental to businesses and their bottom lines and the future of the industry.
Yeah, absolutely. Well, I was wondering what motivated the B1M to get involved, and obviously your own personal experience was a huge motivator in this initiative. I want to bring Sasha in on this from a Procore perspective, because I think one of the first times I really heard about Get Construction Talking was at an industry conference, and Sasha had a team of folks and volunteers and around, and was talking about this topic. So from a Procore perspective, and you joining in this effort and helping promote this effort, Sasha, I just want to bring you in the conversation and talk about why it's important to Procore, why it's important to you as well.
Yeah, I think, well, Procore from a technology and product side, we've always been involved in health and safety, making sure that we have technology that allows project teams to report incidents, to track issues on job sites, and really leverage technology to have a more holistic view of safety on a project. And in 2020, we actually launched a continuing education on-demand course around bringing the right mindset to the job site. We had no idea what 2020 was going to turn out to be, but it turned out to be very fortuitous that we actually had an education course that included a conversation around mental health as well as physical health. And when we launched that, we saw an over 60% uptake in consumption of our online training content, specifically that course. And so we realized we had really hit a nerve and that there was an absence of content around this in the industry. We invited Fred to be one of our keynote presenters at Groundbreak in 2022. And he had the courage on that stage in front of over 4,000 people to share his journey with mental health, what he shared at the start of this podcast. And I was in the audience, and you could literally hear a pin drop as he opened up and talked about what his struggle was and how he was actively seeking help to address this issue for himself, and how it just really caused him to say, well, what is the state of the industry? And some of those statistics that you heard him share, for many people, it was the first time they had understood that in the last 3 years, construction has risen to the top of any industry for death by suicide as being the highest factor for deaths of any industry. And that's alarming. I don't think we as an industry want that to be our banner conversation. And so when Fred approached us about how he wanted to create a campaign really focused on getting the industry talking, destigmatizing this conversation, creating a space where people could say, hey, I'm not doing okay. Or conversely, where someone can notice and observe a fellow colleague and a fellow project team member and say, hey, I'm just want to check in on you. Are you doing all right? How are you doing? Just creating that open door, very much aligned with Procore and some of the efforts that we've had around mental health and physical health and safety. And so it was a very organic coming together of these two organizations to really kind of say, we need to start a global conversation that we hope we're just the catalyst and that the industry really moves this forward. So it was a very organic way that the two came together to start a global conversation about this.
Yeah, it's an incredibly important topic, and I didn't realize it was as big of an issue in the construction industry. Now hearing this information, and then also seeing the exhibit booth at a industry conference, I didn't realize it was the problem that it is. But it is something that we are facing many challenges, but the people of the industry are obviously the most important piece of our industry. So it is something we need to face head on. So Fred, I was over on the website, getconstructiontalking.org, a few times now, and I noticed it's kind of in some bold letters. It starts here. What is that all about?
Well, I think, when we came to this, we were very conscious that there have been a number of mental health initiatives before in the construction sector, and there are many, many initiatives out there in construction covering all different kinds of topic areas. And what we didn't want to do was try and reinvent the wheel and recreate what was already there. You might not know this. In fact, many people listening probably don't know this, but there are a number of fantastic charities around the world working to try and tackle construction's mental health crisis, but many of them are not known about or are not really well signposted to or celebrated. There's the Construction Industry Alliance for Suicide Prevention in the US, who do a fantastic job, albeit I think they've only got one full-time employee. You know, in a country of 300 million people, there's only one dedicated full-time person for mental health in that charity in the US. There's the Lighthouse charity in the UK. There's Mates in Mind in the UK. There's Construction Sport in the UK. And also down in Australia, there's Mates in Construction who do a fantastic job down there as well. And what I saw really was that the support services are there. You know, they have the helplines, they have the tech services, they have the free to download and access resources, which is great, but no one really knows about this issue. So I looked at, you know, what is it that we can do as the BNM and Procore? What can we bring to the table? And the answer that came to mind was basically amplifying this message and trying to get as many people out there as possible to understand the basics of mental health and recognize that it starts with each of us. So it starts here, comes down to the fact that every single person in this industry has a role to play in tackling this crisis. Whether you have struggled with your mental health or not, whether you think it applies to you or not, we all have a role to spot the signs, think about it in our everyday life, and look out for the people closest to us. At the end of the day, no one knows you better than the people you work with every day, the people you go to lunch with, the people you drive around in your van with, the people you work with site to site. They are always going to know you better than an HR manager or a mental health first aider, as fantastic as those people are. So if we can enable millions of people around the world to spot the signs, ask their mates, their colleagues, the people they work with, are you okay today? You don't seem yourself lately. Is everything all right? Shall we go and catch up after work? Because I'm just sensing you're under a bit of pressure at the minute. And then point them towards that support if they need it. Point them towards those fantastic charities that already exist. We can massively help to move the dial on this issue. I think all the stuff that's going on within businesses, with mental health first aiders, with initiatives to try and get more people aware of this and trained up in sectors is fantastic. But if we're really going to move the dial, we need to get millions of people more aware of this issue, thinking about it and spotting the signs. And that, I think, is the unique kind of value that the B1M and Procore can bring to the table. We're very, very good at reaching millions of people. What we're not so good at is diagnosing mental health problems and treating and assisting people, which is what the charities are there for.
Yeah, I mean, that is a great perspective. I mean, because it is such an important topic that we kind of all want to address it, but we in the construction industry are not all professionally trained to be able to address the problem. So it sounds like that the getconstructiontalking.org, that website really becomes a connection portal, right, for not only the people that need help, but also people that want to help.
Definitely. And we have a free toolkit on there to download, which gives guidance for individuals and businesses on what they can do to help. Again, it starts with you, that first step, how you can get involved, how you can support us. And what I would say, there's some great information in there, and I would encourage people to go and look at getconstructiontalking.org to find out more. But what I would say to people listening is that, as you've just said, Johnny, we're not we're not equipped to diagnose and solve these problems for people. And if someone does open up to you, if they come to you, if you find people leaning on you, just being there and listening and being supportive as a friend is the most important thing you can do. You haven't got to fix it. You haven't got to solve it. You haven't got to diagnose it. But being there and supporting them and listening and then directing them towards support and checking in on them is the most important thing you can do. If we all did that in this industry, we would bring those statistics down overnight.
Wow. And I was at Procore Groundbreak last year, and I think there was an announcement last year about Procore's investment in this, and I just want to take a moment to commend Procore for really getting on this initiative and really amplifying it. And Sasha, you holding the megaphone. I remember there were podcasts that were happening at that booth area. There were a lot of volunteers giving out information, and it was kind of centralized around the same idea. It's just the initial step of being there for someone, not just to listen to them.
Yeah. And I think one of the things that when we pulled this campaign together, we wanted to make sure was that there were two concurrent paths into this conversation. One is for that individual that Fred just spoke of, but second was for the business to make a commitment. And the booth that you're speaking of, Johnny, was the Culture Lounge at Groundbreak, where we incorporated CIASP, which is one of the nonprofits that Fred mentioned, the primary nonprofit in the U.S. that we're fundraising for. They joined us in the booth, and we didn't engage in too many live conversations, but gave people sticky notes to put up on a board, kind of expressing their thoughts around this topic. And it was very sobering reading those sticky notes at the end of the conference that had accumulated. And I lost count of how many said it's about time. And so I think creating a space for the individual conversation, but then also for how do business leaders take a stand and show proactive efforts to address this. Procore donated $50,000 towards raising $1 million for these nonprofits across the globe, really as a way of taking that first step as a first mover and showing our customers we're investing in helping them solve some of the challenges that they face, this being one of them. Hoping that other business leaders will follow suit behind Procore and invest as well. The more we invest in these nonprofits, the more resources, toolbox talks, the more how do we get started? Where do we begin? The more resources companies have to actually build this, whether it's built into their actual safety program. So you're giving your safety managers, site managers, more resources and tools to effectively address this at the project level, or as an organization. So as they're looking to recruit the next generation, they can say, we have taken a stand towards addressing mental health in construction. We believe in culture drives change and creates environments where people can thrive. And so we really wanted to create those two concurrent paths into this conversation. And because this is construction, into taking action quickly, rather than kind of sitting in a space of, I don't really know how to react to this. We wanted to create a clear path for taking action.
Absolutely, and thanks for being the role models to help that. I mean, even in this conversation, we have two unique perspectives of how those concurrent paths you mentioned really can converge to address the industry issue. So I'm curious if there's any more data or statistics you want to share. I did hear one the other day, and I don't know how scientific it was, and I don't think it was related to the construction industry, but I think it was just in general, and I believe it was 1 in 4 people basically have been impacted by the mental health crisis. And so I'm just curious, and with all the work you've done and the research you've done in this area, any other statistics or data you think is important to share with our audience?
Yeah, absolutely. I think there are some key statistics I've mentioned already. 2 people in the UK construction sector taking their lives on average every day. You being 5 times more likely to die by suicide in the US construction sector than you are in any other sector in the US, which is shocking. But I think sometimes we can get caught up a little bit on the big holistic data and forget some of the deeper, softer dynamics behind it. And some of the statistics we're seeing is that this doesn't exclusively affect men, but it does overwhelmingly affect men, particularly in construction, which is still a very male-dominated industry. And that dynamic of men putting on a stiff face, a brave face, carrying on, not showing weakness, can make opening up and talking about these issues quite difficult. And I don't mind saying I put myself very much in that camp. Opening up, sharing my story, admitting I was struggling, seeking help. Each of those steps were incredibly difficult for me because I'd been taught my whole life to stay strong, put a brave face on, keep going, don't show weakness. And that doesn't work. I'll spoiler alert for everyone out there that's going through the same process. At some point, you're going to have to speak up and share your journey because it just doesn't work. There's a lot of men out there in construction doing that right now. There's a lot of women doing it as well, and there are across wider society. I think throw in the other dynamic of the fact that work in construction can be quite cyclical. Sometimes you can have jobs on and you've got money, which is great. Sometimes you are looking for jobs, you haven't got money. That's harder. The hours can be long. The journey times can be long. You're on strict deadlines, both in terms of program and budget to get things done. That all makes for a very, very challenging dynamic. And I think particularly where we have lots of other people who seem very strong, very sort of strong-willed and perfectionists and high flyers, you can create this culture. Well, if I want to be like that, if I want to be successful, I have to just keep going no matter what. What we don't realize is that many of those people, and again, I put myself in that bucket, are actually struggling behind the scenes. I'm someone who's a very, very good actor. I put on a really good front to convince people that I was absolutely fine when I was screaming inside. There are many people doing that. And I think opening up about it and normalizing conversations about it all the way up an organization, from the CEO all the way down, is incredibly important.
Yeah, you bring up a great point, because I was, not having done the research, I was wondering, well, why is this such an issue in construction? But you're right, can be a very feast or famine type industry. So you can be from working, 45 days straight with, hardly any time off, to all of a sudden, you're working to get your next bid awarded, and it can be a lean time. So that's a very interesting point, and it can be very volatile for many folks. That is a great perspective, Fred. So I know that the Get Construction Talking initiative has several. You mentioned toolkits and toolboxes. Can we talk about some of the resources that are available, and how have they been received thus far? What's the type of feedback you've received?
Absolutely. So I'll let Sasha chip in as well. But we've basically put together a short video series on the B1M. So again, leaning into what the B1M is best at, we've put a dedicated video series around mental health in construction on our main YouTube channel to over 3 million subscribers. So it's getting put out there. It's getting put front and center, certainly through the B1M's megaphone. Procore have done a similar thing across their platforms and website as well, which is excellent. We've also put together a podcast episode. There's a free toolkit to download over at getconstructiontalking.org. And we're also mobilizing to raise $1 million for construction mental health charities worldwide, so that we're not just talking about this, but we're actually properly investing in those organizations to help them be able to scale and support the scale of the industry that we actually are. There are hundreds of millions of people in this industry worldwide. Many of them struggle with their mental health. So having the infrastructure there to support them as we raise awareness is critically important.
And I'll add to that, one of the things that we did last year was actually have a global launch campaign. So we kicked off the launch in London in June or July. And then we moved to Chicago at Groundbreak, and we had a live panel there. And then in early November, we kicked off in Sydney, Australia. Each of those live events were recorded, and you can go to getconstructiontalking.org, or you can go to Procore's health and safety landing page and see each of those launch events. And one of the reasons why we wanted to capture the conversation, the panel conversation, as well as the questions, is we wanted just to be able to demonstrate how consistent the challenge is across the globe. We're not that unique from each other in these regions, and how consistent the nature of construction as an industry creates an environment where this can be more of an issue than in other industries. But we are very optimistic to believe that construction as an industry is a very action-oriented industry. When you illuminate the path forward or reveal the tools to take that step and to take action, construction is not one to shy away from taking those steps and taking action. So we wanted to make sure that leaders had video resources to hear their peers. We've interviewed multiple CEOs in those videos about what they and their organization are doing. the conversation around company culture and how a safety culture really changed the tides of what we were seeing as far as death rates on job sites due to accidents. We believe the same thing can be done here for mental health, creating that awareness and almost the peer sharing of information with CEOs. We hope creates a spark that ignites a movement of change and action from leaders within construction to really take the kind of the lead and the charge of saying, we are changing this tide in our industry, and we are directly committed to making sure that these statistics change within the next few years.
And Sasha, you speak very passionately about it. So I know we heard from Fred and his personal connection and motivation, and listening to you talk very passionately about it. I'm just curious, why is this important to you as an individual? We've talked about the organizations. We've talked about why it's important to Fred. I'm just curious, Sasha, if there's anything you want to share about why this is more than a part of your work.
Well, I've been very, very fortunate in my career. I started out working for a specialty contractor in construction and fell in love with the industry. But very early, I was actually recruited into technology. And I was passionate about how technology was the great equalizer, meaning that even small firms could compete with larger firms in having digital deliverables. And I spent a lot of my career evangelizing, if you will, technology. But I've always focused on how are these tools enabling people to do better work and to show up. I'm passionate about construction, similar to Fred. I love this industry immensely. But I also recognize how some of our practices as an industry, some of our business practices, and other constraints have really limited or maximize people as a commodity versus a services industry model. And I believe that technology does play a role in enabling people to work better, to communicate more clearly. And if I were to be ever so brave or bold, to build trust and enable people to have trust in their trade partners and their work partners and on projects, which does impact mental health. It's almost, to me, the idea of the future state we're trying to get to in this industry is all about enabling people to work more effectively with the information that they need at the right time to do their job more efficiently and effectively. And the conversation of mental health is something I'm super passionate about because it does allow us to put the focus front and center on people and ask businesses, how are you enabling the people within your organizations to work as effectively as possible and removing those barriers in front of them? So it's kind of a culmination of really the focus on technology. But at the heart of it, I'm super passionate about the people who make up this industry. And I believe in their ability to be the best industry and to be an industry that creates the environments that each of us live in, worship, marry, heal, learn. So I find it as a very critical piece of society that I'm very privileged to dedicate my time and energy towards making better.
That's incredibly inspiring just to hear you talk about it in that context, and it is so true. It is everything we do is really revolves around people. And the one thing one thing that I do love about this industry, like you, is that it is the get it done industry, right? The construction industry is all about action and executing and delivering. So just wanted to mention one thing last year and bring it into the conversation. And I had the opportunity to go to my very first Procore groundbreak. And it was very good sessions. Had an opportunity to share some information about our program, but there was a main stage event where Fred, you had the opportunity to interview a fireside chat with Michael Phelps, the U.S. Olympian, and I got to say, ultimate fail on my part. But I had a meeting. I got called into a meeting, and I missed that session. It's ultimate fail, but. Share with our audience a little bit about that discussion, and with me, because I wasn't in the room, so I didn't get to hear it.
No, absolutely. It was an intimate fireside chat with me, Michael Phelps, and 5,000 other people. So, it was pretty high pressure, but really good fun. And I have to say, yeah, that's him coming out and joining Groundbreak, talking not just about, what he's done in his life and his ingredients for success and his successful mindset, which I think has been incredibly useful for many construction firms and construction professionals to hear. To have him talk about his own mental health journey, how he struggled, how he has learned to deal with some of the issues that he's been facing, and how he's now doing a lot of work to advocate and support mental health causes around the world is incredibly inspiring. I have to say, myself and many other younger guys, and all guys, will look up to Michael Phelps because he's superhuman. He's the most decorated Olympian of all time. He kills it. He's got 28 gold medals 28 medals or 25 gold. It's something ridiculous, for goodness sake. He's a machine. I've been in the gym. You always think about Michael Phelps and think, what would Michael Phelps do? Come on, let's hustle, let's push, let's keep going. So to see someone like that, who on the surface looks superhuman, open up, share their journey and say, hey, I struggled too. It can happen to anyone, is incredibly important. Because if Michael Phelps can open up and not appear weak, but still appear like a superhuman, very definition of a man's man, then I think that's fantastic. That enables many other people. It gives permission to many other people to do the same thing. So it was an amazing experience. Obviously, he is an icon. He's a sporting icon. So to get to meet him was awesome. To get to interview him was fantastic. But the best thing was seeing someone like him open up in front of the construction sector and give permission for 5,000 other people to do the same thing.
Yeah, what an incredible way to look at it. You have permission to be vulnerable. You have permission to need help. You have permission to talk about it. And I think that's a very positive message that people need to hear.
I was going to say, I think that was one of my biggest fears as well. I think when I was really struggling, I thought, I can't open up because people will doubt me. People will think, oh, Fred's not 100%. He's not that reliable. We can't work with him. We don't want to, rely on him too much, something like that. And I was just fearful of all kinds of reasons, fearful of my employees doubting me, my customers doubting me, fearful of what it might do for my reputation, progression. Those are completely natural feelings I think many people listening to this will have as well. But the fact is, everyone goes through it, whether you are the President of the United States or the King of England, all the way down through society. We all are human beings and we all go through this. And it doesn't, admitting it and struggling with it doesn't make you weaker. It makes you stronger.
Well said. So for the initiative that you have, Getting Construction Talking, we've talked a little bit about how individuals and organizations and businesses can get involved. And just to kind of wrap up our conversation today, I'd like to give both of you just an opportunity to talk about what you see in the long-term vision, and then also what would you specifically ask people to do who are listening to the podcast?
I think I'll let Sasha answer in terms of businesses and organizations, and perhaps I can answer in terms of individuals. The long-term goal here is to see construction mental health improve across the board. I want to see the numbers of deaths by suicide come down, and I want to see the industry become more compassionate and attract more people for dealing with its mental health and creating an environment where mental well-being is treated as importantly as physical safety. I think we've got to that stage now where an individual in construction would not dream of walking onto a construction site and not putting on boots, high-vis, and a hat. I think if we can get to the same level of instinctive reaction to mental health, we would not embark on a night shift or a 12-hour dig without thinking about what this is going to do to our mental health. I think that'd be incredibly important. The big thing I'd say for individuals is look out for your mates. Even if you are fine, even if you've never questioned or worried about your friends or colleagues, talk to them, ask them how they're doing, ask twice, especially in the UK. We are very good at just saying, I'm fine, when you ask first of all, but actually behind the scenes, we are struggling more than we let on. And look for the signs. If you see someone struggling, if you've seen someone being more quiet than usual, withdrawing from your WhatsApp group, not being as engaged as they used to be, ask them how they're doing, ask them if they're struggling lately, have a chat and point them to support if they need it. If we all do that, as I said earlier, we will effectively create millions of mental health first aiders around the world and can move the dial on this issue.
Yeah, and I think for us on the business side, we're looking to carry the momentum forward. We did create momentum last year in each of these conversations that we had. Multiple CEOs have reached out to Tui Quartermanch, who is the CEO at Procore, looking for one-on-one conversations around the work that Procore is doing with the B1M. And sharing very personal stories of some of their own journeys with their mental health. And so I think as we look forward, one of the things that we're really excited about doing is creating engagement and conversations that turns into action. So the B1M team in the UK has done various community meetings, hosting local regional conversations with leaders in region, engaging with an audience of practitioners. We are looking at doing more of that in the US this coming year. There are various groups in the United States, one in South Florida, actually, Johnny, and kind of near your neck of the woods. The Construction Executive Association has invited us to come out and to present in one of their monthly meetings. So we're seeing an opportunity where the B1M and Procore really can become conversation facilitators, creating a platform for discussion, really allowing the industry to align and unite and to determine how they'll take steps towards making some change. So we're really excited to continue that as we keep moving forward.
Very good. Well, to recap a few things for our audience, mental health issue, the crisis in construction is very real. It's demanding of our attention immediately. It is a crisis that we should address. I had heard several statistics today that I had not heard before. You're 5 times more likely to die of suicide than in any other sector. There's a lot of charities, a lot of resources in place, but people may not know how to connect to those things. And that's part of the mission of this initiative, Forget Construction Talking. What I didn't know before our conversations on this was that it was a place where there's the intersection of business and organizations and individuals. So if people need help individually, or if people in organizations want to help others, this is really a place where those converge. And that's candidly, that's an incredible and beautiful thing. I appreciate the advice that you shared, Fred. As people are working with others, look for those signs, have the conversation, check on each other. And if any of our listeners are struggling, I think one of the best things I heard today also was you have permission to, reach out for help. You have, it affects everybody. Don't be ashamed. Don't be afraid. Reach out for help. Talk to folks. There's a lot of people that care about you. So I want to thank you both for joining us today. Just incredible topic. So very timely. And I love this initiative. And I would just ask our subscribers and followers to go and check out more information on the website, getconstructiontalking.org, and learn more information and get involved wherever you can, and at the very least help relay the message, help amplify the message to the rest of the industry. So thanks for tuning in today. Thank you so much, Fred, and thank you so much, Sasha.
Thanks, Johnny.
Oh, Johnny, thank you so much for the platform. We appreciate you helping to do your part to spread the word.
Thank you. So to our audience, hey, if you enjoyed this episode, we encourage you to like it and share it, especially out of all the episodes we've done. This is such an important message. So please share it across your networks, get the word out. And then also subscribe to our podcast. We'll be continuing to bring you more content like this, anything affecting the built environment. You can also check out our NIBS YouTube channel for more content. And we thank you so much for joining in today.
You've been listening to Building Innovation, the podcast, the official podcast of the National Institute of Building Sciences. For more information, visit our website at nibs.org.